here factors affecting absorption, factors affecting bioavailability, and you have to correlate each factor with its clinical relevance. So these are the today's class objectives. Definition, I know that you all know what is the definition, but when we ask the definition of 1 mark, then you have to explain it properly. What is definition of pharmacokinetic? You all know, remember pharmacon drug we have discussed, and kinesis means movement. Pharmacokinetic, it is a quantitative study, and the definition of these pharmacokinetic, the short definition is what? What is the short definition which you all know? Can anyone write here? What is the definition of pharmacokinetic? I have already described it. Anyone would like to explain the definition? What body does to the drug, right? Usually we say what body does to the drug, and dynamic means what drug does to the body. Very good. So this is one statement definition. If you want to expand, you have to write that it is the quantitative study of drug movement into, within, and out of the body, which includes absorption, distribution, and elimination. You know the each term. Into means that will be the absorption. Within means within the body there will be the distribution of drug, and elimination considered to be out of the body, either via metabolism. So that is the definition of pharmacokinetic. What is the definition of absorption? Absorption means it is transfer of drug from the site of administration to the systemic circulation. Please remember the definition properly. You all know what is absorption, but expand that term. Distribution means transfer of drug to this tissue. That is the next process. And elimination means removal of drug from the body. I told you either through metabolism or maybe via excretion. So this figure is given in all pharmacology book. You can see here the first process will be absorption. Then the term which is given, that is biotransformation. Chemically there will be transformation of the drug to become, to make it inactive. Here in between these absorption and biotransformations, the drug has to reach from the systemic circulation to the tissue, and it will give its action. These drugs can be in the form of, during the distribution, in the form of free drug, or maybe that drug is in the form of bound drug, which we'll discuss in the distribution. Okay, so it will go after absorption, reach to the systemic circulations to the site of action where that drug has to give action, and then there will be a biotransformations. Metabolite will change and it will excrete out. This figure is also it is given in some other book. I'm not going to explain that, but remember that absorption drug could be of a free, during the distribution could be of a bound drug. Distribution, after distributions, drug will have the next step, and that is the metabolism. Before I talk about the details of pharmacokinetic, there are certain points you require to remember here related to the pharmacokinetic. The first point, that is non-ionized, or you can say unionized drugs. They are non-polar and lipid soluble. Little bit of the chemistry term you have to remember here. unionized drugs, they are non-polar and they are lipid soluble. What is the characteristics of these unionized drug lipid soluble? Easily diffusible and absorbable. Okay. So here lipid soluble drugs are absorbed. Drug is absorbed in unionized form. Unionized form means drug has its own characteristics, that is in term of acidic or basic. There are certain drugs which comes under the classification of acidic drug and certain drugs comes under the classification of basic drugs. Now you have to apply these above statement here. Say for example, acidic drug, I would say aspirin. You all know the name of that drug. These aspirin is a acidic drug. So what will be the site of absorption of these drug? This acidic drug is unionized in a acidic medium. And in our body, acidic medium, that is in stomach. So acidic drug will become unionized in stomach, and that is it will absorbed in a unionized form. So acidic drug will absorb in stomach, and similarly it will be implied for basic drugs. There are certain basic drugs, say for example pethidine, I would say it's one of the opioid. Just now you remember the basic drugs, they will absorb in intestine. So site of absorptions, that is related with the unionized form. Ionized drugs, they are water soluble. So the term which is used here, that is polar, and they are almost non-diffusible. Okay, they will transport through the pores also. I will tell you what is the implication. So usually these ionized drugs or water soluble drugs, if it is given oral form and it is absorption is very difficult pores. So it has to be given via injectable form, which will directly go into the blood. Partly ionized and partly non or unionized are partly water soluble, partly lipid soluble. These statements need not to worry to remember. Purely you have to remember acidic and basic drugs, unionized and ionized drug, and lipid soluble and water soluble drugs. So these three terms you all have to remember, and you have to apply its knowledge, clinical implications as per the in relation to the absorption. There are the mechanism. Now, what is the mechanism of drugs? How it passes? It is not the mechanism of drug itself. It is the mechanism of transport of drugs, because drug has to transport via certain process, and then only body will act for that drug. So what is that mechanism of transport of drugs? There are certain process. The first process is called simple passive diffusion. The other process is filtration. Third is active transport. Fourth is facilitated diffusion. And fifth is pinocytosis. So these are the mechanism of transport of drugs, and these mechanism will be followed by drug as per its characteristics. Okay. Here you need not to worry about in detail of this process. I will let you know, I will give you some idea and its clinical implications. But remember that how drug transport, that is the mechanism via this five mechanisms. See, first is passive diffusion. You all know that in our body, every tissues, it is made up of a cell. There is a cell membrane, and that membrane is made up by the layer is phospholipid layer. And in this phospholipid layers, there may be some pores. Now you have to visualize that in this cell membrane, the phospholipids are there. It is very important for the drug to transport. passive drug may be transported via passive diffusion, and that is called bidirectional process. What is the importance here or the clinical significance? That lipid soluble drugs, all lipid soluble drugs, they transport via passive diffusion. Okay. There is another term which is used for lipid soluble, that is hydrophobic. Okay. Most of the drugs, they follow or they transport via passive diffusion. Okay. So the significance, what you all have to remember is that most of the drugs, they transport via passive diffusion, and most of the lipid soluble drugs, they follow this mechanism. Okay. See, I have, here focused one picture, and there you can see that this cell membrane made up of a phospholipids, and there is a channel where there is a proteins are also there. Okay. And these proteins will work as a carrier, and carrier will be for the passive diffusion or facilitated diffusions. Here for passive diffusions, that is most of the drugs follow this mechanism, need not require any carrier. There is an influence of pH, as I told you, that unionized form of the drug will be absorbed and ionizations will help in excretion. So what is the importance of pH in related with the absorption? That the unionized drug will absorb, but ionized will help in excretion. So I could give you one example. Say for example, the acidic drug aspirin. I will tell you this again and again, this example, that aspirin is an acidic drug. So I told you that it become unionized in stomach. So the stomach is a site of absorption. But suppose if there is a aspirin toxicity or aspirin poisoning, and it has to excrete, aspirin poisoning, it required to excrete out from the body. Then you have to make the medium ionized. So suppose if there is a poisonous poisoning of acid drug, you can give the basic substance, so that drug become ionized and excrete out very easily. Okay. So that is the concept related with the pH, but here only I am going to discuss the absorption. So remember the unionized form. There is another mechanism, that is the ion trapping. See, body fluids, their pH is different. Okay. And that body fluid, it is very important for the trapping, or there is another term which is used, reabsorption. There are certain body fluids like which is there in small intestine, breast milk, eye, vaginal secretion, as well as the prostatic secretions. You all have to remember that what is the importance of trapping, that these pH is also important for the trapping, which varies in a different secretions. Okay. So it may play important role in reabsorption capacity. The other mechanism is filtration. So what is filtration here? The passage of drug through, there is a aqueous pores which are lying on the membrane. But this filtration is depends on the drug factor, physical factor, that is a molecular weight or molecular size. If the drug molecular weight is smaller size, less than 100, then it will be very easily filtrate through the membrane. Okay. So most important is this concept is to increase excretion via changing the urinary pH. So always one has to ionize the drug to filter out through the membrane, and which can be excrete out. This is the reason that water soluble, most of the water soluble drugs, they are filtrate very easily and they can excrete out very easily. So one has to give that is in a injectable form. The other mechanism is active transport. active transport means here the movement of drug from lower to higher concentrations, specific protein. I told you there are certain proteins which act as a carrier. What is the clinical implications? That if suppose there are two drugs has to be given, I mean the drug have to be given in a particular condition, then they compete with each other via this mechanism. So what is this mechanism is, I have given example of these two drugs. There is one drug is penicillin, you all know that is antibiotic, and probenecil, which is the drug which is given in patients suffering from gout. Now, suppose if these two drugs are given together, there is some beneficial drug interactions. So, what is that drug beneficial drug interactions? That probenecid also follow active transport. Penicillin is also follow active transport, but probenecid has more amount of these. I mean, the higher efficacy of these mechanism. So, it will increase the duration of action of penicillin. It will remain, I mean, it will help penicillin to remain in the body for longer time. So the frequency of penicillin can be reduced. So that is you will understand these mechanism during the drug-drug interaction class also. But here the question implication is, if there are two drugs following similar mechanism, then one has to compete with other. There could be a beneficial effect, it could be a harmful effect. Most of the natural metabolites, say for example, levodopa, iron, sugar, and amino acids, they follow this mechanism. Okay. Facilitated diffusions, here there is a specific carrier mediated transport is there. And especially only one example, you can say that vitamin B12 from the GIT, it absorbed via facilitated diffusion. Okay. Pinocytosis need not to remember here in detail, but understand you can analyze that it is one of the example of mechanism of transport of drug. So there are 5 mechanisms via which drug transport through the membrane, and it will act, absorb via other factors. Coming to the absorption, I told you the first is definition and enlistment. Second is various mechanism of transport of drug, and now the factors affecting absorption. Absorption is the process by which a drug enters the bloodstream without being chemically altered. Remember, at this process, drug will not alter. The movement of drug from its site of applications into the body, or maybe it will go to the lymphatic system. So what is the relevance of this absorption? Pharmacological relevance is that majority of drugs, they are being lipid soluble. So they are absorbed by passive diffusion, or maybe sometimes few other modes. But primary actions of all lipid soluble drug mechanism is that is passive diffusion. Drugs which are neither lipid soluble or nor water soluble, they are not absorbed from the gut. And that is one example is barium sulfate. Barium sulfate, it is the drug which is not used as such for the any pharmacological relevance or any clinical relevance. The first statement you have to remember, that is lipid soluble as well as the passive diffusion. What is the importance or clinical applications, implications of absorption? The absorption is to determine the frequency of its administration, to ascertain the duration of effective action, and to predict the onset of desired or maybe undesired effect of the drug. So the clinical relevance is that about these 3 statements, it is related with the absorption while one is prescribing drug. Okay. So these process, it determines the frequency. It determines the duration of effective action, and even it determines the desired effect or maybe the undesired effect. So that is the relevance, clinical relevance of this process. Okay. There is a one word which is used usually for this absorption, that is biological lag. What is that biological lag means? It is the time between the administration of drug and development of response or the effect. So that is called the lag period, and that lag period is for the absorption. Okay. The route of administration, it always determines the biological lag. Either it is a oral, parenteral, or maybe the topical. Oral absorption, it is mostly occurred in the upper GI tract. Okay. Drugs given orally may be inactive systemically because of enzymatic degradations of polypeptide within the lumen of GI tract. And that's why one cannot use the drug orally if it follows this process, enzyme degradation. Poor absorptions from GIT. There are certain group of drugs, they have poor absorptions from the GIT. One of the example is aminoglycoside antibiotic. So poor absorption from GIT, there is no use of the drug given by orally. So one has to change the route. And sometimes drug may inactive by first pass metabolism. So either you have to change the route or maybe you have to give the more amount of dose. So this is about the relevance of absorption. So there are certain factors which affect the drug absorption. See, in book it is given that factors affecting drug absorption could be on these three titles, that is pharmaceutical factor, drug factor, and the biological factor. Here I have put in the individual points. You have to see that which point comes under pharmaceutical, drug factor, or maybe the biological factor. First three you can say that is of a itself pharmaceutical factor. First factor which affect the absorption is aqueous solubility of drug. What is aqueous solubility? Drug may be available either in a solid form, may be available in a liquid form. So disintegration and dissolution time is one of the factor which affect absorption. You know that while taking solid drug, it has to disintegrate and then it will dissolve. But while you take liquid preparations, it will directly dissolve. So that is also one of the factor. The second is particle size. If the particle size of the drug is small, of course, absorptions will be fast. Lipid solubility, lipid soluble drugs absorb, water soluble will be excrete out. So lipid solubility is also important. pH of medium, I told you, unionized form will be absorbed and it depends on the pH of the medium. Concentration, when there is a drug which has a more undesired effect, the absorption is depend on the plasma concentration of the drug. So if you remember, I told you in my first class, there is one of the term which is used, that is therapeutic drug monitoring. So one has to monitor the plasma concentrations to decide or to watch the absorption or the proper absorption of the drug. Then the other factor is area of absorbing surface. Suppose the drug is absorbed in intestine, so absorptions will take little longer time, or maybe if it is in a stomach, that means the size, the area of absorbing surface is less. Vascularity means vascular surface, more vascularity, absorption will be more or the fast. There are certain substance which has impact on absorption. So either there is given one drug may hamper the absorption of other, or one drug may increase the absorption of drug. I have written here the example of vitamin C and oral iron preparation. Patients suffering from iron deficiency anemia, if he is taking oral iron preparations and vitamin C has been given, then C will increase the absorption of iron. Okay, so one has to see that if two drugs, one drug may hamper the absorption or one drug may increase the absorption. The other is motility, gastric emptying and intestinal motility. If the gastric emptying and intestinal motility, if there is a high or there is a motility and emptying is fast, then maybe it hamper the absorptions of the drug. Formulation is also depend here. There are certain inert substance which you have learned during your practical class. So that comes under pharmaceutical factors, that there are certain inert substance which has impact on absorption. It may increase the absorption of the drug or maybe reduce the drug. So now coming to the concept of first pass metabolism. So drug inactivations which occurs in GIT, and the main example is nitroglycerin and insulin. So drug which is having this first pass metabolism, I will let you know in details after this some slides. So then what is the clinical significance? One has to change the route, or one has to give a more dose of the drug which having first pass metabolism. Disease state of any, GIT disease or any other disease, it can reduce the absorption of the drug, but especially if there is a GIT disorders, then absorption of the drug may reduce. So you can see here that there are 12 and 13 factors which affect the absorptions. You can divide it among the, as per the pharmaceutics, drug factor or the biological, where here pharmaceutical I have described, drug factors would be of the pH concentration, and biological you can say vascularity and maybe the first pass metabolism and disease state. So these are the factors affecting absorptions. You all have to remember, we ask you sometimes in a long answer questions, maybe in a short one. Usually most of the drugs, they absorb through GIT. So the site is of absorption is stomach, small intestine. Yes, there is another site is mouth. The drug which are giving through inhalational may be the lungs, and if it is given by topical, then the site could be skin. So these are the sites of absorption. Coming to the term which is again very important and related with the absorption, and that is bioavailability. What is bioavailability? In a simple term, it is the amount of drug which is available to biological tissues. If you want to expand that, the exact definition, I have written these two terms, that is rate and extent. Both are important predictors, that is rate and extent of availability of a drug. From where? From a dosage form in an unchanged form in the systemic circulation. So whatever available drugs is there in systemic circulations, here one has to see the rate and extent. So I told you the clinical relevance, that drug will decide, absorption will decide what? So onset depends on the rate and effect depends on the extent. If you remember in my previous 4 slides, 3-4 slides, I told you the clinical relevance of absorption. So absorption decide the frequency, onset, and how much action. What is the effect? It is a beneficial effect or undesired effect. So these are these points are related with the bioavailability. Okay, so onset depends on the rate and effect depends on the extent. So bioavailability is it is also very important for the absorption. If you remember in parental route of administration, I told you that bioavailability of the drug which is given by intravenous, it is 100%. Okay, what is 100%? Rate and extent of the drug which reaches to the systemic circulation. So 100% bioavailability, drug will reach into the vascular compartment or into the blood. Need not to remember this formula how to calculate bioavailability, but again when you will will take the classes of some graphs, then you will understand that what is the area under curve and what is the importance of oral versus parenteral route related to bioavailability. Okay, so what is the bioavailability significance here? The bioavailability, it will provide the informations about what? About maximum concentrations which is achieved after absorption. So for you need not to relate with the formula or calculate the formula. Just understand that bioavailability can be measured will provide the informations of the maximum concentration. Okay, and these called as a Cmax. So maximum concentrations will be achieved after absorptions that can be provided by bioavailability. The other informations which can be it can procure from this bioavailability is the time taken. How much time is required to achieve maximum concentration? That is also we can understand by bioavailability calculation. And area under curve, it gives idea about the extent of absorption. And these all, there is a typical the calculations where there will be a shape of area under curve and which gives the rate of absorption. So for you, please remember what is the definition of bioavailability. What is the pharmacological relevance? These are the pharmacological relevance where one can see understand what is the maximum concentration, how much time taken for this maximum concentration, and what is the extent and rate of absorption. So that is also one of the important point for the absorption, and that is bioavailability. See, there are different bioavailability from different routes. I told you IV has 100% bioavailability. If drug has given via intramuscular, subcutaneous or sublingual, bioavailability will be little less, that is more than 75% but not 100%. If it is given by transdermal, it varies. Okay, so not 100%, it can be 100%, but again it varies. Through rectal also it varies. I told you there is a absorption is erratic. We don't know that how much, we are not sure that it will give 100% bioavailability, right? So that is also important. Oral is also variable, that is 30 to 100%. And bioavailability will be low if the drug follows this first pass metabolism. There are factors which modify bioavailability. So which are the factors? The factors could be the biological factor, what is the dosage regimen, and the environmental factors. So I think these graph, I wanted to show you. This graph is there in, you will interpret this graph during the practical class. What is AUC and what is the dose of, the route of particular drug. The factors affecting oral bioavailability, first is biological factor, second is first pass metabolism, third is pharmaceutical factor, and fourth is genetic influence. If you would say the factors which affect absorption, that is similar kind of factors which affects the bioavailability. Now, see the biological factors, it is totally which I described, that is the pH, the motility, vascularity. This all comes under biological factor which I have discussed in absorption. Here only one relation is first pass metabolism, that is also related with the absorptions. But I told you in last class that when there is a bioavailability reduce, how it reduce? Because there will be rapid metabolic degradations due to first pass metabolism. So if the drug follows this first pass metabolism, then the bioavailability will be less. There is a one factor, pharmaceutical factor, which is very important, is bioequivalence, and genetic influence also relate with the F. Okay. Bioequivalence, and what is its relevance with this bioavailability? Bioequivalence, it is a comparison of bioavailability of different formulations, but the drug is same. Let you know that let me give you one example, that there is a drug, okay, but these A drug formulations brand may be different. Now when you will label, it is a bioequivalence of these formulations when their bioavailability will be same. So we say that suppose in some disease, patient is taking particular brand, okay, then sometimes we emphasize that if you take one particular brand, then you have to continue that brand only. If somebody changes that brand, there is possibility of changing in bioavailability. So that means they are not bioequivalent. So what is the importance, relevance here? That formulations which contain the same ingredient and they are identical in strength, concentration and dosage form, which is considered to be a pharmaceutical equivalent. So same size, same dosage form. If it is capsule, then capsule. If it is tablet, then tablet. If the ingredient is drug A, then it should be in a drug A. If it is of a 500 milligram, then it should be the other drug should be of other brand should be of a 500 milligram, like that. So main important is the formulations will be considered bioequivalent when they are having same active ingredient, same strength, same plasma concentration and same dosage form. Okay. So that is the called bioequivalence. Different manufacture, same amount, same oral formulations, but they may have different plasma concentration. And as I told you, one of the factor affecting absorption is concentration itself. There is a specific amount of concentration required to drug to absorb. So suppose if there is some change in plasma concentrations of any brand or any manufacturer, they are not bioequivalent. And that's why the similar brand one should continue. Okay. So how come it is a non-equivalent? Because there is a difference in first factor, disintegration and dissolution. There may be some different time takes for the disintegrations of the drug, maybe for the dissolutions. So here only there is a mismatch. It leads to therapeutic failure sometimes because what plasma concentration wants, they may not achieve by the other brand. So that they are non-equivalent. And sometimes there are certain drugs which has its own low safety margin property. So that drug, I have given here example. One is digoxin and other is anticoagulant drug. They have inherent property of low safety margin. Now patient is taking digoxin of one brand, and if he change, then there is a possibility that there may be some non-bioequivalent factor. And these non-bioequivalent factor can lead to therapeutic failure or maybe, toxicity. Okay, so that is the importance of bioequivalence, and this bioequivalence is related with the bioavailability. Means both and bioavailability is same, then it is called bioequivalence. Okay, so this is pharmaceutical factor which is related with the bioavailability. And the last is the last factor is first pass metabolism. What is the other term you can say? Pre-systemic metabolism. So what is that? Here drugs during the passage from the site of absorption to the systemic circulation. That is called first pass metabolism. First pass metabolism has tendency to reduce the bioavailability. Okay, inverse high proportion. Extent of metabolism, it depends on the drug and individual. So very, very important for every factor, that is a drug as well as patient's factor. Even orally, it may metabolize in the gut, in the liver, before reaching the systemic circulation. What is the absorption? Drug while taking, that is at the site of the taken drug to the reaching to the systemic circulation. Now here orally may be metabolized in the gut and liver before it reach to the systemic circulation. And if it follows this factor, then there is no use of giving drug orally, or one has to change the route. Or maybe possible, if you increase the dose, there is a chances that some amount will not reach to the systemic circulation and some amount will reach to the systemic circulation. So important feature, these first pass metabolism, it is important feature of oral route of drug administration. So here, see, oral administered drug, it will reach to this intestinal mucosal metabolism, and it will have this hepatic metabolism. Now these both metabolism process is called first pass metabolism. After this, the drug will enter into the systemic circulation. So the sum of the drugs which follows this first pass metabolism, there is chances that it will not reach to the systemic circulations, and here in this two site only it will metabolize. So those drugs who follows this type of process, one has to change the route. You can give parenteral administration, so directly it will reach to the systemic circulation. Okay, so that is the importance or clinical relevance of first pass metabolism. So what is the implications? That if the drug is having a partial compensations, because it has a first pass metabolism, you can change you can compensate this process via giving higher dose or maybe changing the route. The typical example here, that is nitroglycerin. I told you it has to be given by sublingual route. The propranolol, if it has to be given, I think the more here, the higher dose is required. And salbutamol, it is one of the drug which is given in bronchial asthma. The route has been changed, so it has to be given inhalational route. Okay, for the effect or the proper absorptions, one has to see this factor. Sometimes there is a complete first pass metabolism. The drug which follows complete first pass metabolism means it is sure that it will metabolize through liver and the gut. So here 100% route has to change. So now you can see that isoprenaline, hydrocortisone, insulin, these are the drugs which is not available orally. It is always has to be given via parenteral route, because it is follow the first pass metabolism, complete first pass metabolism process. Okay, so route is important and the drug characteristics important for the absorption. Okay, and that's why you can see that there is an apparent difference in the drug bioavailability. all drugs, they are not same in a F. The drug which is in patients who is having liver disease, what happened here? The first pass metabolism may be reduced. Okay, drug who follows first pass metabolism, but liver is compromised. So there is a less chance कि metabolism वहाँ होगा ही नहीं. So what will happen here? That there will be active amount, I mean the greater amount of the active drug will be there in systemic circulation. So what will be the implications? One has to monitor the concentration. Okay, so in liver disease, if somebody is giving any drug and if that drug follows first pass metabolism, one has to be very cautious regarding the dose. What are the factors which vary, where the first pass metabolism may vary, variable? The first is genetic variation. Genetic variations here, the bioavailability may be vary. Especially here I have written the drug called hydralazine. It is one of the drug which is given in as an antihypertensive. So hydralazine it has impact on genetic variations. What are the genetic variations? There are certain persons who are called fast acetylator and certain person the certain genetic variations is called slow acetylator. So when somebody has to give hydralazine, what happened here? The bioavailability of hydralazine will be double in a slow acetylator compared to fast acetylator. Now, these implications of fast acetylations and slow acetylations, you will understand during the pharmacodynamic and where it is called the idiosyncratic reactions. Okay. For this absorption, remember that there are drugs which varies in a various genetic variations, and there you have to see the bioavailability and the dose. There are certain drugs which has inductions of metabolism of other drug, and certain drug they have capacity of inhibitions of certain drug. That is also has impact on first pass metabolism and bioavailability. Food also increase sometimes the liver blood flow and which can increase the bioavailability. So these there is a simple term, the statement that what is the relation between the first pass metabolism and bioavailability? It has an inverse proportion. जहां first pass metabolism होगा वहां bioavailability will be less, और जहां नहीं होगा I mean that there will be a high bioavailability. But all these depends on various factors, and again that is a genetic factor, the drug metabolism capacity factor, and food. So these are the impact of first pass metabolism in relation with the absorptions. See, there are certain drugs which undergo this first pass effect in liver. So one has to change the route, or maybe one has to increase the dose. So these are the certain examples which I have written. See, nitrates, isosorbate dinitrate and glyceride trinitrate, morphine and pethidine, they are the opioid, xylocaine, one of the anesthetic agents, and these propranolol, it is given as a, cardiovascular drug, and imipramine and amitriptyline, they are given in the patient suffering from depression. So now, just now you can remember 2 or 3 names of the drug which follows first pass effect. So what is to be done for better absorption? That is the relevance of this first pass metabolism. So last is, what are the key points here which you all have to remember? That I told you about the kinetic definition and the various mechanism of transport of drugs. Then I told you regarding the factors affecting absorptions. There are 12 or 13 factors which you have to remember, one line of each factor and its relevance. And lastly, I told you the important points for absorption, that is bioavailability and bioequivalence. And lastly, the key point is relevance between the bioavailability and first pass metabolism. So these all I have already discussed. So the key point is bioavailability is a fraction of given dose which reach to the systemic circulation. So rate and extent. These availability determine the dose, and especially IV route, it has a 100% bioavailability. The drug which is having high bioavailability, it required there is a requirement of lesser dose. And if there is a low bioavailability, one has to give higher dose. So it is the proportion between the bioavailability and the dose. What are the factors here? Increased absorptions can lead to increased bioavailability. So they are the similar. And decreased absorptions can lead to decreased bioavailability. First pass metabolism relations is reverse, which I have already told you. And one of the example is nitroglycerin, which is following this process where you have to change the route of drug administration. Nitroglycerin can be given via sublingual route. So these are the key points of the absorptions factors and some of the relevant points. Next class will be the second process, and there also important factors I am going to discuss. I have given assignment to you in my last class. I think today I will stop here because I need to go.